Good afternoon, everyone. My name is Lena Shally. I'm a second-year medical student at Geisinger Commonwealth School of Medicine. This presentation is on the clinical and financial outcomes of peroral endoscopic myotomy compared to laparoscopic Heller myotomy for treatment of achalasia. Oh, right there, okay. And I have no disclosures. Peroral endoscopic myotomy, or POEM, has been established in literature as first-line therapy for achalasia, resulting in symptomatic outcomes similar to that of Heller myotomy, in addition to shorter operative times and shorter hospital stays, as demonstrated in these studies. Specifically regarding post-operative symptomatic outcomes, multiple studies have found that POEM is equally, if not more, successful than Heller in improving the symptoms of achalasia. For example, Schlottman et al. In 2018 found that across 74 studies, dysphagia was improved in 93.2% of POEM patients compared to 87.7% of Heller patients. Several studies that have also included a financial analysis have found that POEM is more cost-effective than Heller. For example, Attar et al. In 2020 reported that POEM resulted in charges of $5,000 less than Heller. However, most of the literature focused on procedure charge rather than cost, an unreliable indicator of the cost-effectiveness of the procedure. Our study will focus on the total variable cost of each procedure rather than what insurance companies were charged. And finally, we did not find any other studies that compared hospital reimbursement between the two procedures. The purpose of our study was to compare the outcomes of POEM and Heller at our institution, as well as to investigate the hospital costs and reimbursements of physicians for the two procedures. Our question was, does our institution demonstrate similar clinical and financial benefits of POEM as seen in the literature, and are payers recognizing this success? The inclusion criteria for our study was the diagnosis of achalasia, or another esophageal dysmotility disorder, and all patients had complete preoperative data and at least one complete set of postoperative data for the 7 variables that we analyzed. The most recent follow-up time point was used for each patient, and we excluded patients who were less than 18 or had their surgery at an outside facility. Our study retrospectively examined data from the Geisinger system between 2014 and 2021, and cost and reimbursement data was available starting in 2018. To analyze our data, we used the Mann-Whitney test for continuous variables and the chi-square test for categorical variables, and symptom scores were analyzed using permutation t-tests. Statistical significance was defined as a p-value of less than 0.05, and surgical success was defined as a postoperative Eckert score of 3 or less postoperatively. In this table, we have our patient demographics, in which we found no statistically significant difference in either age, BMI, Charlson score, or percent of patients having undergone previous therapy, which included pneumatic dilation, Botox, or a previous POEM or Heller. At an average follow-up time of 28.6 months for POEM and 34.8 months for Heller, we found that POEM trended towards being more successful than Heller, with 88% achieving a postoperative Eckert score of 3 or less, compared to 76% with Heller, in addition to having shorter operative times and a shorter hospital stay, with almost half of POEM patients being discharged on the same day. The median length of stay was 1.2 days for Heller and 0.76 days for POEM, and POEM was able to achieve a longer median myotomy length. Both procedures had a major complication rate of 0%. Here we see outcomes of Eckert score and dysphagia at more than 2 years post-surgery. Again, POEM showed a trend towards a greater reduction in Eckert score. However, dysphagia alone had a significantly different mean change between the two groups. Scored from 0 to 3, post-surgery mean dysphagia values were decreased by 1.12 for Heller and 2.3 for POEM. Here we see outcomes of regurgitation, heartburn, and medication use, which included PPIs and H2 blockers. Literature has previously shown that POEM may lead to increased levels of esophageal acid exposure. And although there was a trend towards Heller patients using fewer antacid medications and having lower heartburn scores post-surgery compared to POEM patients, we found no significant difference in symptomatic heartburn or antacid medication use between the two groups. Of note, heartburn scores in the POEM patients were equivalent pre- and post-operatively. Finally, we have our outcomes of GERD health-related quality of life score and reflux symptom index, and both symptom scoring methods showed comparable improvements in both POEM and Heller. Moving on to our cost and reimbursement analysis, we hypothesized that lower costs would be incurred in POEM due to its minimally invasive nature. And we found that median hospital costs were significantly lower for POEM than Heller, with median costs at $3,606 for Heller and $1,415 for POEM, which is more than 2.5 times less. The variability in POEM costs may be attributed to whether the procedure was performed in an endoscopy lab or in the OR, with the endoscopy lab costing significantly less. Because our institution's cost data was only available from 2018 onwards, we could not analyze costs for all patients included in our study, resulting in a pretty small sample size for both groups. To make sure that a similar trend would occur with a larger sample size, we double-checked using all available cost data, including patients from outside our study. And as shown in this graph, POEM still costs much less than Heller, even with a larger sample size. In this table, we summarize total cost and reimbursement data, with reimbursement data demonstrating poor recognition by payers for the benefits of POEM highlighted in this presentation and by many other studies previously mentioned. Median hospital reimbursement was dramatically less for POEM at $952 compared to $12,641 for Heller. As of January 1st, 2022, POEM now has its own CPT code, which we hope will help close this gap. In conclusion, POEM is associated with a shorter operative time and hospital stay, a longer myotomy length, and a greater resolution of dysphagia compared to Heller. POEM costs significantly less, but is poorly reimbursed. Our hope is that this study will encourage hospital cost transparency as well as recognition by payers of the benefits of minimally invasive procedures to patients and hospitals by reimbursing them comparably to their more invasive predecessors. Thank you, and I can take any questions.